everyone, and welcome to the SavvyCast. I am so grateful that you're here today, whether you are watching on YouTube or listening on your favorite podcast platform. And I have a return guest, Dr. Ben Pearce. He is a plastic surgeon at Reveal Beauty, and many of you have downloaded and listened to his podcast or watched his last YouTube. His information is so helpful in so many different topics. Actually, Dr. Pearce, and welcome to the SavvyCast.
Well, thanks again for having me back, Jamie. I'm super excited. I think we have a lot of interesting things to talk about, and I'm excited just to educate.
Well, that's great. And this is actually your third time to be here. Your first time you were here on National Breast Health.
Yeah, we talked about breast cancer and just things to be aware of and how to make sure that you're doing everything that you can to make sure that you're safe. That was a great talk.
Right. And then you and Dr. Clinton were on a month or so ago, and you answered Q&A.
Yeah, it was like a potpourri.
It was. Yes.
Different topics.
Y'all pivoted so well from many, many topics. But Dr. Pearce, I've had a lot of people ask this question, and you are definitely the expert. Ask some of these questions regarding skin. So I wanted you to come and weigh in because you know as much or more about skin than anyone. And but before we start, I'm asking all of the people on the SavvyCast to share something fun at the very beginning.
Okay.
What would you request for your last meal?
This is tough. For me personally, there's so many different food types that I love. And I really like things like outside of the box for what my family makes. You know, for what my wife normally makes, or thinking back to even when I was a kid, what my mother would make us to eat. And so if I could, I'm probably going to cheat in my answer here. I'd like it to be a multi-course meal. I would like components of it to be Vietnamese and Japanese, and then also some more comfort food. Like, why not go ahead, throw the fried chicken in there, spaghetti. So I guess the last meal for me would be a very gluttonous, like it would be like a 3-hour feast of of basically everything that I love from all different areas of the world.
That's awesome. Spanning the globe. Well, that's wonderful. You have very cosmopolitan taste. That's great. But anyway, okay, well, now let's talk skin. And Dr. Pearce, could you just preface this conversation by helping us understand the things that we cannot control that we might want to lay on the table and not get so frustrated about, because we all have those things. So
right. So with everything being equal, say everyone is taking good care of their skin in terms of SPF, sunscreen, just limiting your UV exposure. If you're doing all those things, there are certain changes that occur that we can't control. And so for people as we're aging, that's the development of wrinkles. That's the development of loose skin. If you're doing everything that you can, those things just happen. And that's something we enjoy treating here, at a plastic surgeon's office. But the flip side of that is I would say this affects more so younger people, but it's not just a younger person problem. And that's acne. We do typically see it around the teenage years, but you have some people that fight with this and deal with this into their 40s. And it's not because you're not clean, you're not taking care of yourself. It's just for whatever reason, your skin has a setup for this to occur. And so that is usually out of one's control.
Did you feel that most acne is something that is someone's more genetically predisposed to that?
Definitely.
Okay. And in any given family, you can have siblings who one struggles, one doesn't. And it's just, we don't really know why. Is that correct?
We don't know why. We have the basics that we understand, the oiliness content of the skin. And then it's a predisposition for certain bacteria just to live in certain people's skin or top skin layers. And that's what creates acne vulgaris is the medical term that we use for it. So it's a challenging thing, and it's really challenging, I say, for the younger years. When your kids are at school, they're comparing themselves to others. And why am I dealing with this? And my friend right across the classroom isn't. Unfortunately, there's no great answer to that. It's just genetics.
Well, I would like to have you back at some point to just dive into that topic and maybe some of the various options. But today, I thought that we would just speak to mainly my demographic or the general adults.
Okay.
mostly women are probably interested in this, but skincare, skin products, and procedures. We all want beautiful skin. We want our skin to look its best. And in my mind, and you can probably help give a clearer picture, I divide it into two categories: texture and tightening, or,
Hmm.
can you sort of explain? And I know that changes with age. I know an 18-year-old's probably not worried about tightening, it's mainly
Hmm.
texture. But how would you address, the different ways to look at skin?
Yeah, I think that's a good way to divide it. And I think another good way to divide it would be, what things can I do at home versus what things do I have to go see a healthcare professional for? And so if you kind of divide it, like I said, even further into that, I think that kind of helps give people an idea of what can they do, what can they be active in their skincare role at home versus when do you need to see someone. And
Mhm.
so if you break that down into the basics, it's really simple. It's important to have a cleansing system that works well. That's usually something that you're going to do at least twice a day. That would be ideal. I know that's hard, but just think of that as the time when you're brushing your teeth. Hopefully, you brush your teeth twice a day. That would be a good time to work on that cleanser. At the same time, after that cleanser, a solid moisturizer that has some component of SPF, some sort of sunblock in it. And I'm not talking about what you lather on your whole body when you go to the beach and everyone around you knows that person's got a lot of
Yeah.
sunblock on. Most of the time, if you are doing a light foundation, there are a lot of makeups that have SPF in it, and I think that's a huge benefit. And I feel like that's where the guys or males sort of lag behind because we don't have that a part of our daily routine, or typically we don't, where we apply makeup. And so I think that's a big difference that you see when you move down through the years. When you say you have a 50-year-old female and a 50-year-old male, the difference in their skin is usually pretty drastic. The male, like you said, texture wise, it's a bit thicker. The wrinkles or rhytids tend to be thicker as well. And I think that's from years of sun exposure without some sort of sunblock place, where the ladies tend to have that as a part of their routine makeup wearing.
And when you say SPF, do you mean just in the morning routine, the morning cleanse?
Usually that's enough.
Okay. What
The,
recommendation? Do you say 30,
yeah,
40?
at least 30. And you'll if you kind of try to do a deep dive into this, a good way to do that, by the way, is if you're on Google, there's a way to queue up what's called Google Scholar. And when you do your searches on Google, it basically filters out just websites where they're just trying to sell you things, and it just pulls up scholarly journals and papers, things that we use when we're talking about new treatments or just validating older. And so,
Wonderful.
but anyway, I digress. If you do a deep dive, you're going to see a lot of different recommendations, but everyone kind of comes to the agreement that at least 30 is sufficient. And you brought up a good point of the need for a reapplication. Oftentimes, the only people that are going to need a reapplication midday are those that are outdoors all day. They have a lot of moisture on their face, usually from sweating,
Mhm.
or if your line of work involves you getting in the water. And so that's just the potential for it to wash.
Okay. So, of course, everyone needs to cleanse and then do the SPF. Do you recommend C for every woman over a certain age? Or I know that's part of my regimen. I
Hmm.
put C on every morning. What is your
Yeah.
take on that?
Yeah, vitamin C. So to me, there's two different ones that are really good that can be a part of everyone's daily plan. That's either vitamin C or a hyaluronic acid. And then you'll find that there are some combinations from different companies that usually they can have a little bit of both.
Mhm.
And so vitamin C, it usually has a moisturizing component. It's supposed to decrease inflammation. It's an antioxidant, and so that's sort of fighting the chemicals that we experience every day as we just go out to our environment. And it promotes collagen production. And so that kind of goes back to what you're talking about, that kind of tightening, that goal of having that tighter skin, decreasing the amount of fine wrinkles that we develop as we age. If you switch gears and you talk about hyaluronic acid, that also promotes moisture. That's the main thing. Hyaluronic acid is something that we have in our skin already, and again, it draws moisture in, and so it really helps with that, the reduction in fine wrinkles, because as the skin is more plump, you don't really notice things like fine wrinkles as much as you would when your skin is dehydrated.
hmm So, would you apply the HA after the C?
You could do that. And I'll be honest with you, I I think these products, when you're buying them from reputable companies, it's really easy. I'm going to do another segue about Google. It's really easy to type in hyaluronic acid on Google, and
Right.
you're going to get hundreds of results. But if you get it from a reputable company, Skin Medica, Obagi, medical grade skincare is what we call it around here.
Mhm.
If you follow the instructions, I think that you're going to be safe and you're going to get the best bang for your buck, so to speak.
Mhm.
But oftentimes, like you said, it would be okay to apply it in that way.
Well, I'm a huge believer in C, and I've
Hmm.
used those brands you mentioned. And I feel like for my skin, I can definitely tell a difference. Even when I apply it, my face immediately seems to just look healthier and have more of a
Hmm.
glow.
Like a glow. Yeah.
A glow, yes, it does. And it seems like it just gives it a refresh. You would recommend C then to every woman? You think it is beneficial? It's
Yeah.
scientifically beneficial.
Beneficial for everyday use in the environment of the US with the amount of toxins and pollutants in the air, but also to help again with UV rays. I think for any age group, that's an appropriate one. And that's one that's not a bad idea to start when you're younger, when you're starting to maybe take notice of yourself and those around you. And you're like, well, hey, I saw that person and they were pretty wrinkly. They had a lot of sun damage. I don't want that to happen. And so I think that's a good time to start that, when you're younger, starting to realize.
Dr. Pearce, what about retin-A or retinol
Hmm.
for not for acne, but just for part of your routine?
Right. So this is another good one when we're talking about. You just type in the word retinol on Google, what pops up? A million results.
Mhm.
And so I'm going to try to just break it down and tell you what's important about it. And so when you see retinol or retinoids, they're just referring to retinoic acid, which is a metabolite of vitamin A. And so this is commonly used, like you mentioned, for acne treatment. So what it does or how it works is it decreases the keratinocyte. That's one of our top layers of skin, the cohesiveness that it has. So it allows them to sort of break apart a little bit easier. And in doing so, it causes skin turnover to be faster. It also will decrease the chances of you having blackheads or white because it's not allowing the more thick secretions from our sweat glands, and our hair follicles to sort of plug things up because now the skin is a little bit looser, it's turning over faster. You can just think of it as that top layer is just not as adhesive as it used to be, and therefore it turns over more quickly. So you can find retinol products that are over the counter. You can pick them up at your local department store, but then you can also get prescription or medical grade ones, from a physician. And so what you're getting there is you're getting a higher percentage of that retinoic acid. And with that higher percentage comes greater results. I'm not saying that the over the counter stuff is not good, but if you really want to see a result, I think that's the way to go is to get a prescription type retinoic acid treatment.
Well,
It's
when you mentioned medical grade, I am one of the philosophy do the biggest bang for your buck, and I actually do 20% C. I try to do 1% A, but I sometimes have to
it's
go.
hard, huh?
It
Isn't
is,
it?
yeah. If you're dry, especially, but I do think that speaks to what you just said. If you buy it at Target or the department store,
Hmm.
it's not going to be. Are they able to sell anything medical grade, even at Sephora? What is medical grade? Is it to a certain?
I guess I'm implying a lot of different things. So back to our retinols or retinoic acids, medical grade in that if it's backed by true science, and I hate saying that because I never want to imply that there's a company that just says, look, we made this complex or this mineral formulation, here it is, and we're going to tell you it fixes all of these things. And the reality is, unfortunately, sometimes none of that stuff's really clinically tested. It's a big difference when you go through a clinical trial and then you have a control group, meaning a group that's not receiving that medication, and you have a true comparison, multiple eyes are taking a look. People are blinded, as we call it, where they don't know which side got which. And so that's medical grade skincare. The other component is getting in these higher percentages, meaning you're getting a higher amount of retinoic acid that you just can't buy over the counter because it could be unsafe if used on the wrong individuals or used too frequently. And so back to what you were talking about earlier about it's hard for someone with drier skin to tolerate maybe that 1% retinoic acid. We have a philosophy around here, just stick with it.
Yeah,
It's
that's
so
mine.
hard. because
Yeah.
it's uncomfortable.
Mm-hmm.
But if you're trying a retinoic acid and you seem to be having trouble sticking to it, we have other options. We can decrease the percentage, the strength, so to speak, and or decrease the frequency. So if someone was doing it once a day and they just couldn't tolerate it, maybe 3 times a week. And so there's always some wiggle room to play with that. But if you can stick with it, the outcome of using a retinoic acid is huge. I think that's one of the most powerful tools we have for a topical treatment to aging, and then just also having that rejuvenated glow.
Will say, and this is probably what you all mean when you say stick through it or push through it. I just the way I look at it, at least with my skin, is I do not baby my skin because I feel like the older you get, the more you have to rough it up, the more you have to, stick through things that may not feel the greatest just because of the end result. And I know, I can't remember why in my early marriage, I got off of Retin-A because I wasn't sure that it was working.
Mm-hmm.
I just did a little test. And after 6 or 8 weeks, I just could tell I looked pasty and dull. Mm-hmm. And I mean, it was a very dramatic, very evident difference. So I think to that point, it's something you're not going to see immediately, but it works. It actually works. And if you stop doing it, you'll see, but maybe not immediately. So that's what I tell my daughters. Some of the things that work the best, you don't always see immediate results. It's just a lifelong thing that, you choose to do it. But okay, those are things that, is there anything else that you would recommend as part of a regular routine for normal women besides the cleansing and the sunscreen, of course, C and A as things that really work? Is there anything else that I'm leaving out?
I think that covers all the main categories. And then I think as we're going to progress through this discussion, there's some things that I can recommend that are more targeted at certain problem areas. But I think you and I have covered a lot of the good ones for just kind of everyone, like a blanket statement that these work well for everyone in terms of just promoting healthy skin.
Yes. And Dr. Pearce, let me toss in this, because you've mentioned medical grade, and I do believe in that. I buy my products from the doctor's office. When you look at the price for a good medical grade C, between 100, 150, and then a retinoid is, I would say, 50 to 100. You are going to spend something initially, but the amount, would you not say, I mean, I know personally, I just use a few drops of the C and then.
That's all you need.
Yeah, yes. So speak to that it's just enough. Like, do you describe the dosages like pea size? Or?
I do. Yeah, we 100% do that because that's truly all you need. I think we're a product, and this is speaking for Americans, but many Americans, we have it. We have an excess. We have the opportunity to live in excess. Mm-hmm. And so we do that with our food, our cars, our houses. Mm-hmm. And then the same thing goes for our products that we place on our skin. You'll just see people just squeeze it, and then it's just like their hand is loaded. Mm-hmm. You totally don't need that. And if you don't do that, you can follow that, like you said, that pea-sized amount, you'll get so much longevity or so many more miles, so to speak, out of these products, where that if you break it down for that cost, and then if you look at how much you're actually spending every month, it's not that bad.
Right.
And then one of the things we like to talk to people about is we know there's a sticker shock when you see the prices of some of these product lines that we feel like we can strongly stand behind. Mm-hmm. Oftentimes, if you bring in, say, a lot of the different products that you're buying from your different department stores, the cost is usually more when you add up all the different things you're buying from these department stores that are over the counter. If you try to get the span of 6 months and what that treatment costs, it tends to be more. And then also in our eyes, less effective, because again, we can give prescriptions for higher powers or stronger ointments and creams.
Right. And would you say to put everything that you're putting on your face, just go down and get your neck?
There's definitely no reason not to do that.
Be beneficial to your neck as well, and you'll have an older looking neck. Okay, and that leads me to, we're going away from the face to some other areas. You mentioned that there's some specialty products that you would recommend to people for specific skin issues. I have one, and many listeners or viewers might also have these brown spots I don't know if they're sunspots, age spots, they're probably both, but I have them all over my hands and maybe one or two on my face. What is the best way to treat those?
So this kind of falls back into our medical grade skincare. So one of the best products for these darker spots, another skin condition is called melasma. And you'll see that more so in females, middle-aged females. And it's usually a darker area that has coalesced. It's not just little spots. It's usually a big area of the cheek or a big area of the forehead. And so those big areas that are darker, in addition to those age spots or brown spots, is hydroquinone. I don't know if you've heard of that.
Yes.
And so there, for example, there's a lot of different Obagi products that have that in there. And it's typically about 4%. That's the strength that they frequently use. And it's in their blender, clear, and sun fader complexes. And that really helps with brightening up those spots. And and you could think of it, it's a bleaching agent for the skin. And so it's just used in those areas to help turn over the skin.
So let's say someone had the spots on their hands, and let's say I started a 4% hydroquinone. How long would it take for me to see results? And could it eliminate, or would it just lighten?
For some people, it does get close to elimination. But I would say you have to give it at least a month.
Okay.
And then make sure, and I always tell people this with skincare, make sure you take a picture, because it's very easy for when you're doing something like this to yourself that you're seeing it every day. So you don't notice these incremental changes. We have the opportunity here in the office. We recommend this, and then we just see you back in 2 weeks or 4 weeks. We can see it immediately if it's made a change, because we're not looking at you every day.
Right.
And so just take a picture, because sometimes you'll get frustrated or discouraged. You're like, why am I even doing this? I feel like I'm not making any progress. It really helps to do that.
Yes, I agree. I'm sure you all recommend to keep sunscreen on the hands.
Right.
As we get older, this is where a lot of our age shows, is in our hands.
Right.
Also, what about anything that you can recommend for under eye circles? Just maybe not bags, but someone who has dark circles.
This is a tough one. And if there was this amazing home run product, everyone in the world would be using it. And I'm not saying there aren't good products for it, but I'm going to be honest with you, I don't think there's this magic solution yet for this issue. But a couple good products. One is a skin medica product, and that's called the Instant Bright Eye Cream. And it uses a couple different components that really help make a difference. And one is the phenylethyl, and that helps with hyperpigmentation, or that darker appearance in the under eye area. And then it also has hyaluronic acid. And again, remember, hyaluronic acid, it promotes an improved moisturization of that area. And so I think that's a big part of what helps decrease that appearance of that dark under eye, is as that kind of draws in more volume, more fluid to the area, it helps to decrease that appearance of that darker sunken in eye. And so you have to think about, what is the issue with the dark under eye area? And oftentimes it's a volume issue. One of the first places that we start to lose fat in our face as we age is the under eye area. And so that's a big part of why people get that darkened appearance, is from a lack of volume. And another product that's from the Obagi line is called Elastoderm, and it utilizes zinc and copper, and its goal is to reduce fine lines in that under eye area by promoting elastin production. And so that's the mechanism by which that product works.
I love Elastoderm, and I do think that it helps me in those lines around.
That's one of our biggest sellers. People love Elastoderm.
And it makes your makeup. It's probably one of the best serums I've ever used. Well, do we have time to touch upon some of the things that people who maybe want to do a little more than just the daily regimen and then the skincare products, but want to get into some of the treatments or the procedures?
Sure.
Can you address, because I think as the older we get, the more willing we are to seek beyond the counter, but behind the beauty counter.
Right.
So what would you say? Let's say someone is on a budget and they've got some lines and their skin texture is starting to get a little dull. What are some options?
So one of our favorite options around here, And this is good if you're not ready yet to commit to a procedure. Because I understand there's anxiety there. Some people, that's a hard hurdle to overcome. And so we love the Obagi Nuderm system, and that's a multi-step system. It's just so easy to use, and it covers all of those topics and all those different chemicals that we've already discussed today. Oftentimes there's vitamin C, there's sunscreen, there's the skin lightening that we talked about the hydroquinone, and then also varying degrees of retinol. And so all of that together, it increases skin turnover. It helps with fine wrinkles. It helps with moisture and volume. And so you're getting all of that if you can commit to that kit. And I understand it's kind of a sticker shock. But we see the biggest change in people if they're willing to commit to that. And what's great is that the way it's labeled, it has just numbers on it. 1, 2, 3. Like it makes it very simple. And I think that makes a big difference, especially if someone's just looking to get started, maybe push beyond what's available from the over-the-counter beauty department at your local store. So that's somewhere where we like to point people when they're really getting serious and they want to start something that's going to definitely have a big impact.
Okay. And the kit, the Obagi kit or any medical grade would only be available through a dermatologist or a plastic surgeon's office or a medical facility. Right. Okay.
Right. And that's because there are components of it that are of a higher percentage than what's available over the counter. And therefore you need a physician or healthcare provider to be a part of that prescribing process.
Right. Okay. We'll now move on to what if they're using the kit and they come to you. What are some of the next steps, the logical next steps beyond the kit?
Sure. So now we're going to be talking about procedures, so in this scenario, you've done everything you can, and you just still want a little bit more tightening. And so we can divide this up into different layers of the skin. What layers are we treating? So a popular treatment today is radiofrequency, and this is going to affect the dermis. So this is the layer immediately under the top layer of our skin. This is the strength layer of our skin. This is what ages, or as we age, as it starts to become loose, this is the area that we're looking to treat. And so the radiofrequency, it's treating the dermis by small little needles that heat up the dermis. And when that happens, it causes the scar process to start, and that causes tightening. And so we frequently recommend that people that are starting to see some signs of loose skin to their neck. That's a very popular area, but it doesn't have to end there. It could definitely go into the remainder of the face and help with tightening up the tissues around the eyes, around the mouth as well.
Are you speaking of something like the Infinity, which
right?
Is something
right. The Infinity is the one that we offer. Again, it's multiple small needles that deliver radio frequency, therefore heating the dermis. And so the key the point I want to make about this is not something where your skin sloughs. You just have some local inflammation, some local swelling that usually gets much improved over 24 to 48 hours. So that's what's nice about this application. And I know you've done one, so I guess you could speak to that or your experience.
Yes, and I'm actually doing one this afternoon. The weather we had last week, I had to reschedule. Yes, absolutely. I did not put makeup on that night, but the next day I did, and I probably could have put makeup on, but I just wanted it to be fresh and air out. But I will say, because at 56, I've gone to spas and had membership for different treatments and facials. I felt like I was really getting something done. I mean,
oh yeah, for sure.
Really I thought, okay, this isn't a hydrofacial. This is working. I mean, I did do the numbing and so forth. And true to the way I work, I told them to go all the way to the highest level because I'm like, I can get through this. And she said I was the only one thus far who had gone to the top, but I did it, and it wasn't terrible at all. But I will say, after one, I could tell that I got a little crepey and I did feel tighter. But I'm stacking them.
Right.
I think 5 more or 4 more.
That's what we recommend. We see that people get the best results if they at least stack it. The minimum that I recommend is at least 3.
Mm-hmm.
Um, and we see, again, like you've already kind of clued into this, the best results if you can stack it, because there's no harm in doing it that way,
Mm-hmm.
where you're coming back for a repeat treatment. And
Because
not
the
only does it,
collagen, is there a cycle for how the collagen, you said it stimulates collagen growth. Is that 2 weeks, or how do you determine the month? What's good about that? Giving the
yeah,
collagen time to build?
it's that collagen, but also at that same time, just giving your tissues some time to relax after that stimulation.
Mm-hmm.
And the hope is to sort of catch it in that cycle where things are kind of going up, and then they're going to start to plateau off, and then we hit it again, and just keep going up. And so that's the thought behind that repeat session, as long as your skin can tolerate it. And what's great about these radio frequency devices, most skin types can tolerate this without an issue. It doesn't matter if you're very light or very dark complected. People tend to do really well. And in addition, I wanted to bring this up. One of my favorite applications for this is not just skin tightening, but for someone that's had really bad acne scarring. So say they had severe acne as a teenager and they're now in their 30s. This is something that's a good solution for, how bad scarring can be post acne.
Mm-hmm. So the radio frequency, and I'm sure there are different names for different machines, but
There are.
it's not a laser, but it's radio frequency energy or heat.
It's energy that then turns into heat.
Okay. So, and it is strictly for tightening, not texture.
We've noticed, again, like say with the acne scarring, it can help smooth things out because that dermis sort of gets reinvigorated, more collagen production, and it can help smooth things out. There are various forms of acne scarring. There's what's called ice picking scars, and those are very small, little, just like the name suggests, it almost looks like an ice pick. There's box scar where you have flattened areas with definitive edges. And so it just, when you treat the whole area, the area that's scarred from the acne, and then the areas surrounding it, it promotes, like you said, good collagen ingrowth, and it really helps smooth things out.
Right. Well, now let me ask you about this, because I am alternating another treatment with this company, and it is a Hollywood peel, and that is more for texture, correct?
Right.
And I will say, my best friend asked me about it, and I told her again, I said, I will never go get a hydrofacial again, because that felt so, I literally
you could feel it.
Oh my goodness. And you could feel it, you could see it. I just felt like it was working. And can you explain what it does? And because I was amazed at the Hollywood pill. I really was.
So it's a slight misnomer when we say peel, or at least I don't like people to get scared, because when people think of peels, they think of almost like a snake shedding its skin. The top layer is coming off, and there's going to be dead skin everywhere all around me, scaring my family, my friends, my coworkers. So that's a quick treatment. Again, that treatment doesn't seem to be bothered by different skin types or skin colors. It seems to be well tolerated by all. And it just is really helping kind of exfoliate the skin, almost zapping off or taking off that top layer. And it kind of creates that nice glow. Some of our patients refer to it as almost as if you got that pregnancy glow. And so some people will do it, maybe not so much now because of COVID and the pandemic, but they were doing it say you had a date or you had some sort of event you were going to that evening, and they would just come in and get that done right before that event for that big date. And they became radiant. That's what it does for the skin. It just really helps with that top layer.
And I will say it's extremely interesting the way you do it is you get the carbon.
Carbon is applied onto the skin, and it basically zaps that off and it makes it evaporate. And the process of that evaporation is then what affects that top layer of skin for that exfoliation.
So if someone is listening and they want to get on a good regimen, and they maybe have been spending money on facials and things that really may feel great, but therapeutically aren't doing that much, would you recommend, just for beautiful glowy skin and to tighten, maybe alternating the not radioactive.
Radioactive. You're going to scare everyone.
Yes, yes. The infinity or the
radio frequency
with the Hollywood peel or that texture.
Yeah, I think that's a great idea because, again, those target different areas. The radio frequency is that deeper dermis layer, whereas the Hollywood laser peel is that upper layer of skin, the epidermis, and then those layers that we have sloughing on a routine basis. It kind of just helps clean those off. Similar, I don't know if you've ever tried this, but I'm sure you've heard about it. If you haven't tried it, is dermaplane. And so that is the process of a mechanical exfoliation. And so that's the use of a sharp surface like a knife to take off that top layer of skin. And I think that helps a lot too, kind of creating a little bit of more of a youthful appearance. But at the same time, a lot of people will say that this helps promote all of the skincare stuff that you're doing at home to be able to get in a little deeper because you're taking off that top layer of dead cells, allowing your skincare to penetrate a little bit deeper.
Well, I dermaplane at home, which I don't know if everyone want to do that. And I do microneedle at home with Steve. And again, but when I come and have that done, like I'm doing at Reveal Beauty, it's just a whole nother level, something I could not do at home. I don't have the equipment or the expertise, but I just truly think it makes a difference because I can tell before and after. So now let me ask you about, I know that there are these treatments, because I mean, I'm doing them and I can attest that there's really no downtime. What if you're okay with some downtime or you want something a little more big bang for the buck? What would you recommend for skin?
Skincare, that we're always going to say here, the CO2 laser. What that's doing is the target of that laser is water. We call it the water is the chromophore. That's what's absorbing the laser. And then that results in a small explosion, if you will, of that water molecule, which then causes resurfacing of the skin. And that one does, like you said, if you could take the downtime, which is not a painful downtime, it's just you're a bit unsightly. It looks like you've had the worst sunburn in your entire life. But it just basically resets. It resets the skin, and that collagen production is up, elastin production is up, fine wrinkles are wiped away or reduced significantly. And so it has a really big impact on a lot of different areas that people are looking to change. Dyschromia, which is the fancy medical term for skin color that's not homogeneous, meaning it's not the same throughout. It really helps kind of even the skin tone as well.
If you are not having any kind of surgical procedure like a neck lift, can you do that on face and neck?
Yeah, you can.
You can. Okay. Now I've had several friends who've done it, and yes, there is definite downtime. I mean, they sent pictures and it was not, you don't want to go out,
right?
But the results were amazing. And if I recall, one friend who was never a smoker, but we get these lines, I think those went away. Is that?
Yeah, that's when people come in here and they're complaining about fine wrinkles around their mouth, especially around the eye and the under eye area. If they just say, hey doc, I'm not going to do this skincare stuff. I'm being honest with you. And they say, I just want something, just like a one and done. And that's what we recommend. That's a good way to take care of it, or something that we can do. That's like a one-time treatment.
So you can do several, monthly visits, alternating maybe the Hollywood peel with the Infinity, or you can do the core, get it all knocked out, and which the core, will it do tightening?
It does tighten as a part of that rejuvenation of the skin.
If someone wants to do just that, they're not having any other procedure, how do you medicate or numb for that?
Sure. So if they're going to go for the strongest CO2 laser that we have, we can do topical numbing with several small injections of a local numbing medication, along with some oral medications that help you relax or become a bit more sedated, where you're not really that worried about what's going on around you. But we can step that up if we have to. We can do an IV sedation, sort of like you would have if you were undergoing an endoscopy type procedure. But then there are some individuals that they're they're nervous about all of it. And they're just like, just
Yeah.
knock me out completely. And if you need to, we can put you to sleep, fully
Mhm.
to sleep. And then the procedure itself still only takes about 15 minutes. So it's a very short period of general anesthesia.
Oh, okay. Now, if you do neck and hands, do you also recommend it for hands that have age spots, or would you treat that more less at?
That's going to be a different laser because it's usually on the hands. We're not really dealing with the surface issue so much as we're dealing with the discoloration, and the CO2 can help with that. But some other options that work well for those discolorations that you're talking about on the hands is what's called a BBL or broadband light, and that's a different type of treatment.
Can you address that? Because that is skin, correct? It's just more
Right.
discoloration. So a BBL light, is
Right.
that
And
a laser?
so what it is focusing energy on certain wavelengths that are going to target certain colors of the skin. And
Mhm.
so, if we know that you're specifically interested in treating brown spots, we can sort of tailor a lot of these different light sources towards that. Now, the BBL kind of gives you a lot of different spectrums of light, but it gives you in a very intense pulse, and that's how you're getting that change in that treatment, or excuse me, that change in that targeted area, is it's really firing hard on those areas. But the difference is say the BBL versus the CO2. The CO2 kind of goes through that burned skin recovery period, where the BBL you can have that done and you can go to work the next day because it doesn't result in this resurfacing. It's affecting the colors that are deeper in the skin.
Would it require repeated treatments to get rid
Yes.
of significant?
100%.
Okay.
It is not a one and done. In many ways, it's sort of like the RF, and that the best outcome is if you have at least three. But typically, it can take up to 6 treatments, if not more, to get some improved results in your discoloration. Say you've got some red skin, you've got small little blood vessels. Usually, people will develop that in their nose.
Mhm.
If they're very fair skinned to begin with, those it takes usually repeat sessions.
And do you sometimes combine that with bleaching cream? Will that expedite
Yeah,
the results?
yeah, definitely. There's definitely nothing wrong with doing that.
So if someone is listening and they are intrigued or they want to delve more into one of these particular types of devices or
Hmm.
treatments, and they don't live here and they haven't
Sure.
heard you all describe what you have, how do you know? There's so many different machines. It's almost like
Oh,
shopping for mattresses. There's so many different ones and they might have different names at different stores. How do you
hmm
find the right treatment wherever you live? Do
Uh,
you
the,
tell?
the the easiest way is just going to be to get in touch with your local physician's office, and you just have to tell them what you're interested in, what you're looking for. And because of the pandemic, a lot of offices are doing virtual consultations a lot more than they used to. It's becoming the norm now, and so I think that's an easy way for you to get your skin out there and say, these are my concerns, what can I do? And I think that should be the takeaway from this, is just you have to seek some consultation, some help, because this stuff is very confusing. We spend our whole lives going through medical training talk about this stuff. And so I don't ever anticipate that after hearing something like this, that you're going to know exactly what you need, for whatever problems that you're experiencing. So I think it just, you can make that consultation, either meet with the physician's team, including the esthetician. That's a good way to get you on the right path to, whatever your goals are.
Well, I think you have offered such valuable information for anyone, whether you don't want to spend a lot or you want to invest a little bit more. But
Hmm.
I think this is so helpful because I do think that a lot of us spend money on things that we think are helping because maybe they're marketed as effective,
Right.
but in the long run, they're maybe not medically approved. So I appreciate how you have shared all of this with us. And is there anything else that you would like to share? Just one last bit of advice about skin and how to make it beautiful, keep it beautiful.
I think it just, if you start early, that's our biggest.
Yeah.
We can't turn back time, but if I could get any information out there, is if you can start when you're young, start at least with sunscreen, and just either wearing a hat or something. It makes such a big difference in the long term.
Because it's harder to reverse than to
Right. To
right.
prevent. Right.
Okay. Well, Dr. Pearce, thank you. This was so helpful as always. And I will share with everyone how to get in touch with you.
Great.
And I will be seeing you all in a few hours for my infany.
Well, thank you. Have a
But
nice day.
thank you, Dr. Pearce. You as well.